Hello and welcome to our presentation. This was done by Javid and Ezekiel. Our case study is about Susan. Susan is a 40-year-old mother of two who works part-time during the day. She has not regularly exercised for 10 years, but is now keen to lose weight as she values her health. She finds the gym threatening and lacks confidence in her ability to perform the exercises. Also, she does not attend some classes because of not enjoying a particular instructor's session. This is difficult for Susan as she finds it hard to exercise alone and she enjoys the social aspect of a group. Family and friends have in the past supported Susan with exercise. However, despite this, Susan feels guilty about not exercising and makes continual excuses not to do so because she has too many things that make it impossible to fit in.
The psychological approach is a view that involves certain beliefs about human behavior and it is broken down into three categories: cognitive, behavioral, and humanistic.
Cognitive psychology is mental processes. For example, it's thoughts, memory, perception, interpretation, etc. These are all cognitive psychology.
Behavioral psychology is how human behavior is learned and how environmental factors affect the behavior of an individual. There are two processes in which people can learn from the environment: classical and operant conditioning. For example, Pavlov rang a bell before he served food to his dogs, and after repeating this procedure several times, the dogs would salivate as the bell was rang, as they would associate the sound of the bell to the food. This is known as classical conditioning, because the dogs associated the stimuli, which is the bell, to the response, the food.
Operant conditioning is when a person learns through rewards and punishment for behavior. B.F. Skinner studied this by placing lab rats in a Skinner box. If the lab rat pressed the blue button, he would receive food as a reward. If he pressed the red button, he would receive an electric shock. As a result, the lab rat would learn to press the blue button but not the red one.
Humanism is a psychological approach that studies the whole person. Each person has a unique perception of the world, and people are free to make their own choices and goals. Humanistic psychologists look at human behavior through the eyes of the person as well as the observer. For Rogers, the focus of psychology is how individuals interpret and perceive events. This is important because he redirected psychology towards the study of the self.
Bandura's social cognitive theory states that people learn from the interaction of all personal, behavior, and environmental factors. However, since Susan hasn't exercised regularly in 10 years, she has not been in the correct environment to observe the correct behavior to learn from.
Self-efficacy is one's belief in one's ability to succeed in specific situations and can affect the outcome by performing a specific action. Susan has a low self-efficacy as she finds the gym threatening and she lacks confidence in her own ability to exercise. Due to this, she will occasionally make excuses not to exercise as she feels she has too many things to do.
The self-determination theory was formed by Deci and Ryan. This says that people are extrinsically motivated to participate in activities because they want to prove to themselves that they are capable of performing the task. Intrinsic motivation is how interested and satisfied you are, whilst extrinsic motivation regards around ego and self-control. Positive feedback and verbal praise will enhance intrinsic motivation, whereas criticism and negative feedback would decrease intrinsic motivation. In Susan's case, she is not intrinsically motivated to go to the gym because she is not confident in her abilities to exercise.
Pavlov states that a stimuli affects a response. In Susan's case, the stimuli would be the gym environment. Susan's response to the stimuli is negative as she does not enjoy her instruction sessions and she finds the gym threatening.
B.F. Skinner states that operant conditioning is when a person learns through rewards and punishment. Susan is keen to lose weight, but she will not be able to complete this goal unless she goes to the gym. The punishment of not losing weight acts as a motivation to go to the gym.
Edward Thorndike is responsible on the learning theory that led to the development of the operant conditioning. He studied learning in cats by placing them in a puzzle box. They were encouraged to escape to reach the fish outside, which was the reward. They would eventually stumble across a lever that opens the cage. This was repeated several times, and in successive trials, the cats would learn that pressing the lever would open the cage. Furthermore, Thorndike put forward a law of effect. This law states that any behaviour followed by pleasant consequence is likely to be repeated, whereas any behaviour followed by unpleasant consequences is likely to be stopped. In Susan's case, it is obvious that the pleasant consequence is losing weight, which may persuade her to go to the gym.
Client-centered therapy is a form of psychotherapy that was developed by Carl Rogers. The assumption is that the client is best able to deal with their personal problems, and the therapist is best to offer a non-directive approach that does not advise the client, but instead encourages them to explore and work themselves out. This form of psychotherapy involves sharing ideas, listening, and thinking together, as well as seeking and giving feedback. In Susan's case, her friends and family have supported Susan with exercise, and according to Rogers' theory, it is Susan's duty to explore and work herself out in order to lose weight, which is what she intends to do.
Existential psychotherapy is a style of therapy that emphasizes the human condition. This style of therapy lauds humans' aspirations and capacities whilst acknowledging human limitations. In Susan's case, we can acknowledge that she aspires to go to the gym and to lose weight as she values her health and she enjoys the social aspect of a group. However, she lacks confidence in her abilities and she has not regularly exercised in 10 years. This can be seen as a limitation which may stop her from progressing in what she aspires to do.
An intervention is an act of intervening in a situation. The sweat trial was a study conducted by Cox et al. In 2003, and this intervention was carried over 12 months for middle-aged women. The findings of the sweat trial showed an improvement in fitness levels in women after only 6 months of light walking and swimming. The light endurance exercises used in this intervention shows that Susan can improve her fitness and health by doing light walking and swimming regularly. Also, Susan enjoys the social aspect of a group, so she can include family and friends that would also like to exercise, as this would motivate her to exercise regularly.
Goal setting is very helpful as it gives direction to the attention. Provided an overview of over 100 studies on how setting goals affects performance. In 90% of these studies, it appeared that setting specific goals or difficult challenges led to better performances than easy goals or merely being told to do your best. In Susan's case, she should set goals such as exercising 3 sessions a week, as shown to be effective in the sweat trial, because it would help improve her fitness and health.
Imagery is using all the senses to create or recreate an experience in the mind. Susan can visualize her past successful experiences to give her some confidence before she participates in physical activity. Susan can concentrate on creating a mental picture of herself exercising in a gym environment alongside her friends and family because she would enjoy the social aspects of a group. Guided imagery may also be used if imagery is not as effective as expected. Anderson conducted a study in 2011 to determine which condition would make participants perform better. This study found that guided imagery can increase exercise behaviour in individuals with a sedentary lifestyle.